It's time to sit back, relax, and listen to Change Your Attitude, Change Your Life. Change Your Attitude, Change Your Life will inspire, motivate, and empower you. Live your best life now. Listen, learn, think, and decide. Change your attitude, change your life. And now, here's your host, Joan Herman.
Welcome to Change Your Attitude, Change Your Life. I'm Joan Herman. Thanks for tuning in. Change Your Attitude, Change Your Life brings you interviews with some of the most inspirational and influential people in the world. It's our goal to educate and empower you so you can live your best life now. Thank you for taking time for yourself, and thank you for letting us be a part of your life. We have another great show for you today. According to today's guest, Dr. Michael Greger, the vast majority of premature deaths can be prevented through simple changes in diet and lifestyle. Dr. Greger examined the top 15 causes of death in America and believes that nutritional and lifestyle interventions can sometimes be more beneficial than pharmaceutical and surgical approaches to help prevent and reverse these diseases. Dr. Greger is here today to teach us which foods to eat and which lifestyle changes to make in order to live longer. Dr. Greger is a physician, author, and speaker on clinical nutrition. He is the author of the New York Times bestseller, How Not to Die, and he runs nutritionfacts.org. His new book is The How Not to Die Cookbook. Welcome, Dr. Greger. Thanks for joining us.
I'm so excited to be here.
Well, we're excited to have you here because what you're about to share with us has the potential to save lives. In your previous book, How Not to Die, you discussed the top causes of death in America. What were the diseases that you studied?
Yeah, so the first half of the book is just 15 chapters on each of the 15 leading causes of death. I talk about the role diet may play in preventing, arresting, or reversing each of our top 15 killers, but I didn't just want it to be kind of a reference book. I wanted it to kind of be a practical guide on making kind of day-to-day grocery store type decisions. So that became the second half of the book, where I center my recommendations around a daily dozen checklist of all the things I encourage people to fit into their daily routine, like, berries every day, the healthiest fruits, greens every day, the healthiest vegetables, a tablespoon of ground flax seeds, a quarter teaspoon of turmeric, the best beverages, the best sweeteners, how much exercise they get every day. Basically, just trying to inspire people to fit some of these healthiest of healthy foods into their daily diet.
Doctor, what does the science say about the relationship between nutrition, lifestyle, and good health?
Well, there's only one diet that's ever been proven to reverse heart disease, for example, in the majority of patients, a plant-based diet. Now, look, if that's all a plant-based diet could do, reverse our number one killer of men and women, then shouldn't that kind of be the default diet until proven otherwise? Mm-hmm. And the fact that it can also be effective in preventing, arresting, or reversing other leading killers like type 2 diabetes and high blood pressure would seem to make the case for plant-based eating simply overwhelming.
Doctor, there are so many different types of diets on the market today. Do you think we're harming ourselves by following some of these?
Oh, my God, there's some terrible diets. In fact, the U.S. News and World Report every January puts out their, best and worst diets. And I was honored to be part of their kind of their cadre of judges this year. And so I think the diet that came in dead last was these ketogenic diets, and they can be really quite harmful. But look, diets in general, don't work by definition because, you go on them, you go off of them. It's not about what you eat next week or next month. It's really what you're going to eat for the next decades. And so you need to find a diet that's not only health promoting, but, convenient and affordable and it tastes great. Really, that's where the evidence points to, the healthiest diet being one that minimizes, in general, the intake of meat, eggs, dairy, and processed junk and maximizes the intake of fruits and vegetables and legumes. There's your beans, split peas, chickpeas, and lentils, whole grains, nuts and seeds, mushrooms, herbs, and spices, basically real food that grows out of the ground. These are our healthiest choices.
It's time that we start to visit the pharmacy, F-A-R-M, instead of the pharmacy, P-H-A-R-M.
Well, so look, certainly there's a role for medications and surgery. Look, you break a leg, we can patch that up with a cast. You have an infection, there's still antibiotics that can be quite effective in curing. But when it comes to lifestyle diseases, which is about 80% of what people go to the doctor for in primary care these days, comes to lifestyle diseases, I mean, the cause is not drug deficiencies. I mean, the cause is poor lifestyle choices. And so instead of just covering up the symptoms or, using drugs to try to slow down the rate of one's decline or slow down or reduce the risk of complications, better to treat the cause, treat the lifestyle causes themselves in hopes that you can reverse the disease in the first place instead of just managing the disease, which is unfortunately kind of the more mainstream medical approach these days.
Why do you think people opt for the quick fix, that they'd rather take a pill than take your advice?
Well, I think they just don't know. I mean, it's in ignorance. Studies show that people wildly overestimate the powers of pills and procedures to keep them healthy. So, for example, patients believe these cholesterol-lowering statin drugs are about 20 times more effective than they actually are in preventing heart attacks. So it's like, well, no wonder most people continue to rely on drugs to save them. But, leading killers, the dirty little secret is that most people surveyed said they wouldn't even be willing to take these drugs if they knew how little benefit they actually offered. Whereas treating the, actual cause by cleaning up our diets not only safer and cheaper, but can be more effective in treating, arresting, and reversing many of our leading causes of death.
Doctor, in general, do you believe that doctors are getting better trained to recommend food and lifestyle changes rather than just prescribe meds?
Slowly but surely, but too slowly. Doctors have a severe nutrition deficiency in education. Most doctors just never taught about the impact healthy nutrition can have on the course of illness, and so they graduate without this powerful tool in their medical toolbox. Now, look, there's also institutional barriers such as time constraints, lack of reimbursement, and in general, doctors simply aren't paid for counseling people on how to take better care of themselves. Of course, the drug companies also play a role in influencing medical education and practice. You can ask your doctor when's the last time they were taken out to dinner by Big Broccoli. It's probably been a while.
Well, I am such a fan of your work because I'm the type of person, when I don't feel well, I literally will crush garlic and eat that for a few days. And I can tell you, almost immediately, you can see the results in how I feel.
And even better is if you were eating garlic all along, maybe you wouldn't have felt bad in the first place. And that's right. Prevention is still right. And so often, there are certain foods that can have such powerful pharmacological-like effects that people use them in that way to treat conditions. But I like to think of foods as more as the basis of kind of preventive medicine in the first place. Although it's nice to know that there are certain foods that we can use to, if for some reason our health slips in one way or another.
Can you give us a few examples of diet changes that could combat a particular disease or two?
Oh, absolutely. So, for example, ground flax seeds. So the reason I recommend 1 tablespoon of ground flax seeds a day is that flax seeds are the single most concentrated source of a class of anti-cancer compounds called lignans, but you do have to ground them up. If you eat whole flax seeds, they just pass right through you. Also a great source of fish-free omega-3s, tested head-to-head. Just a few spoonfuls of ground flax seeds a day can lower blood pressures 2 to 3 times better than our leading blood pressure drugs and only have good side effects, reducing the risk of breast and prostate cancer, helping to control cholesterol, triglycerides, blood sugars, reducing inflammation, curing constipation. That's why I recommend a tablespoon of ground flax seeds every day.
Doctor, you mentioned that prevention is the key. So what should we be eating every day to help ward off disease?
Well, so we should be eating a diet that's centered around whole plant foods. Now, it doesn't matter what you eat on your birthday or holiday special occasions, right? I mean, it's the day-to-day stuff that really adds up. And on a day-to-day basis, we should really try to eat healthier, which is basically centering our diets around the healthiest foods out there, not only to reap their nutritional benefits, but to displace less healthful options.
Doctor, we've been talking about food during this conversation, but what lifestyle recommendations do you recommend we make?
Oh, absolutely. So the global burden of disease studies, the number one risk factor for death and disability is diet. But then number 2 is cigarettes. Cigarettes continue to kill 500,000 Americans every year. Yes, our diet kills hundreds of thousands and more, but absolutely stopping smoking. It's what we put in our mouths, both cigarettes and food, that most determines our health. And then the third component would be exercise. We really need to not only exercise, but prevent long-term sitting, prevent inactivity. So even if you do exercise, even if you go to the gym after work, sitting more than 6 hours a day is not good for us. It may increase our risk of chronic disease. And so keeping active. Now, I recommend 90 minutes of moderate exercise a day or 45 minutes of rigorous exercise. Any amount is better than nothing, absolutely. But the science does show basically the more the better up to the kind of plateau at 90 minutes a day.
The book is The How Not to Die Cookbook, 100 plus recipes to help prevent and reverse disease. If you would like to get more information about the book or Dr. Greger and his work, you can visit drgreger.com. That's drgreger.com. Doctor, in our final moments, what would you like to leave our listeners with?
Oh, I just encourage people. That's my personal website, but if you want to get more information about eating healthy, nutritionfacts.org. It's a free, nonprofit, science-based public service providing new videos and articles every day on the latest in evidence-based nutrition. What a concept. Nutritionfacts.org.
Doctor, thank you so much for being here with us. I think the title of the book, How Not to Die, says it all. And it should be enough to get us to want to read it. So thank you for sharing these strategies to help us live a happier, healthier life.
Well, keep up the good work yourself.
This is Change Your Attitude, Change Your Life. Stay with us. We'll be right back. Thank you for joining us. I hope you found the show informative. At Change Your Attitude, Change Your Life, we believe that knowledge is power. Take what you've learned, apply it, and live your best life now. Remember that the information provided are the opinions of our guests and should never replace the advice of a professional who knows your personal situation. If you'd like more information, visit our website, CYACYL.com. While on the site, listen to past shows on demand, read our digital magazine, take part in the book club, check out our team, and be sure to follow the show on social media. Until next time, this is Joan Herman. Thanks for tuning in.